Talking to women about their pregnancies is one of the most important things we do. In an ideal world, all pregnancies would be both planned and wanted. It is our role as physicians to help women who are faced with an unplanned pregnancy decide what is right for her. Unfortunately, 49% of all pregnancies in the United States are unplanned. Not all of the pregnancies are unwanted, but half are unplanned. About half of these unplanned pregnancies occur during a month when contraception was used in some fashion. Of the unplanned pregnancies, 47% end in abortion, 40% end in live births, and 13% end in miscarriage. Unplanned pregnancies confer excess risk upon the mother, mostly from pregnancy complications such as late entry to care and preterm delivery, and the child. Children who are born as a result of an unplanned pregnancy are more likely to be involved in the foster care system, more likely to be on psychiatric medications, and have lower academic achievement in school. Here is a clinical scenario. Anne is a 22-year-old college student who presents for a pregnancy test. You do not know her very well, but have talked to her in the past about using reliable contraception. The test is positive. In this situation, you do not know whether Anne wants to be pregnant or not. You also do not know whether she's already done a pregnancy test at home. You knock on the door and enter to tell her that her test is positive. There are several ways to convey the results of the test to Anne. The first important thing to remember is that since you don't know whether she wants to be pregnant or not, you should not convey any judgment into the disclosure. You should avoid statements that include emotion, such as, "Congratulations, you are pregnant," or "I'm sorry to tell you, you are pregnant." There are several steps to follow when giving pregnancy test results. First, you must present the test results. Most of this talk will focus on positive tests, because when the test is negative, many women are disappointed, but do not need to make a decision about the pregnancy. In situations with a negative test, the physician may use the visit to discuss reliable contraception if the woman is not actively trying for pregnancy. After you present the test results, you want to see how your patient is feeling about the positive result. Is she happy? Is she disappointed? Is she surprised? You then want to present accurate information to her about her options and develop a follow-up plan regardless of her decision. There are many ways to present a pregnancy test result. We want to be careful not to impose our own values upon the result. Because of that, we should all try to present results in an objective way. For example, the test is positive. We don't want to say congratulations because maybe she doesn't want to be pregnant. Our expression of joy in response to an unwanted pregnancy may alienate the patient and make her feel like she can't talk to you about making an alternate choice. Conversely, she may be happy about being pregnant, so if you respond to the results with dismay, "Oh no, what are you going to do?" you may similarly alienate her. After presenting the test results, the test is positive, be silent for a few seconds, awaiting the reaction of your patient. It is hard to know how a woman is going to react to finding out that she is pregnant. It is also difficult for individual physicians to refrain from imposing their views upon the patient. For instance, you may really think that your patient should choose to terminate the pregnancy for a myriad of social or psychological reasons. Or you may be personally opposed to abortion, in which case you may feel strongly that regardless of her situation, she should have the baby. It is our role as primary care physicians to support our patients in their quest for the right course of action. We may use supportive motivational interviewing techniques, give them information to read about making a choice to parent, adopt, or terminate the pregnancy. You also want to get a sense of who she can talk to about the pregnancy. Is the father of the baby involved? Does she have friends or family members who can help her and support her through this decision process? An example may go as follows, going back to the previous clinical scenario. "Hello, Anne. The pregnancy test is positive. How do you feel about that?" Anne: "Wow. My test was positive at home also, but I didn't believe it. I wasn't planning on getting pregnant, but my boyfriend and I have talked about it and are excited to continue this pregnancy. So Anne has decided to parent and has informed you that she has come to this decision with her boyfriend. You may also want to ask her if she has any family or friends who will support her with the pregnancy and the baby. You also may want to ask your patient whether she knows her choices. Discussion of her personal beliefs about adoption and abortion may be helpful in her decision. Many women do not know that they have a choice. A statement such as, "I talk to all of my patients who have a new pregnancy about the choices. You may choose to have the baby, to have an abortion, or put the baby up for adoption." This is also a good time to discuss medically accurate information about abortion. For example, having an abortion does not impact your chances of future pregnancy. It is important to provide both local and national resources. Each clinic should have available information on access to abortion within the community, as well as adoption resources. The websites included in this slide provide a lot of information that women may find useful in making their decisions. In the previous clinical scenario, where Anne was happy about the pregnancy, you may talk about dating the pregnancy, providing prenatal vitamins, avoidance of teratogens, and also possibly schedule a first prenatal appointment. So, to best help our patients who are faced with an unplanned pregnancy, we should work on keeping our bias out of the conversation, determining the woman's reaction and desires about the pregnancy, determine her support system, provide accurate information about her choices, and schedule a time to follow up by phone or in another office visit to help her come to the right decision for her.